When someone uses 500 milligrams of Trenbolone per week, the effects can be extreme, both in terms of muscle growth and potential side effects. Trenbolone is one of the most powerful anabolic steroids available, known for its ability to dramatically increase strength and lean muscle mass. However, it also comes with significant risks, especially at such a high dosage. This video explores what happens to the body when taking 500 milligrams of Trenbolone weekly, covering both the benefits and the serious drawbacks. Muscle growth and performance enhancement at 500 milligrams per week. Trenbolone significantly accelerates muscle protein synthesis, leading to rapid gains in lean muscle mass. Unlike some steroids that cause water retention, Trenbolone promotes dry, dense muscle growth, making it popular among bodybuilders in cutting phases. Users often report noticeable strength increases within just a few weeks, allowing them to lift heavier weights and train with greater intensity. The drug also enhances nitrogen retention in muscles, which helps prevent muscle breakdown, even in a calorie deficit. This makes Trenbolone highly effective for both bulking and cutting cycles. Fat loss and metabolic effects. Trenbolone has a strong impact on metabolism, increasing the body's ability to burn fat. It does this by boosting the metabolic rate and improving nutrient partitioning, meaning more calories are directed toward muscle growth rather than fat storage. At 500 milligrams per week, these effects become much more pronounced, leading to a leaner, more vascular physique. Some users report visible fat loss even without strict dieting, though optimal results still require proper nutrition and training. Androgenic side effects. Despite its benefits, Trenbolone is highly androgenic, meaning it can cause severe side effects related to its strong interaction with androgen receptors. At 500 milligrams per week, users may experience extreme acne, accelerated hair loss, if genetically predisposed to male pattern baldness, and increased body hair growth. The androgenic nature of Trenbolone can also lead to prostate enlargement, which may cause urinary difficulties. These effects are dose-dependent, meaning the higher the dose, the worse they can become. Cardiovascular strain. One of the most dangerous aspects of Trenbolone is its impact on cardiovascular health. At 500 milligrams per week, users often see significant increases in blood pressure due to Trenbolone's ability to constrict blood vessels and increase red blood cell production. This raises the risk of hypertension, which can lead to heart strain, strokes, or even heart attacks in extreme cases. Cholesterol levels are also negatively affected, with Trenbolone lowering HDL, good cholesterol, and raising LDL, bad cholesterol. Over time, this can contribute to atherosclerosis, hardening of the arteries, increasing long-term cardiovascular risks. Neurotoxicity and mental side effects. Trenbolone is notorious for its psychological effects, often referred to as tren rage. At 500 milligrams per week, users may experience extreme mood swings, increased aggression, anxiety, and even paranoia. Some report insomnia and vivid nightmares, which can severely impact mental health. The drug's neurotoxic properties may also contribute to cognitive dysfunction over time, though more research is needed in this area. These mental side effects make Trenbolone one of the most challenging steroids to use responsibly. Suppression of natural testosterone production. Like most anabolic steroids, Trenbolone shuts down the body's natural testosterone production. At 500 milligrams per week, this suppression is nearly complete, leading to low testosterone symptoms if exogenous testosterone is not used alongside it. Without testosterone replacement, users may experience low libido, erectile dysfunction, fatigue, and depression. Post-cycle therapy, PCT, is essential after stopping Trenbolone to help restore natural hormone levels, but recovery can take months, and some users never fully regain their pre-cycle testosterone function. Liver and kidney stress. Although Trenbolone is not a 17-alpha alkylated steroid, meaning it is not as liver toxic as oral steroids, high doses can still strain the liver. At 500 milligrams per week, liver enzymes may become elevated, indicating stress on the organ. Additionally, Trenbolone can increase kidney workload due to its impact on blood pressure and protein metabolism. Users with pre-existing liver or kidney conditions are at higher risk of complications. Respiratory issues. A unique side effect of Trenbolone is tren cough, a sudden, intense coughing fit that can occur shortly after injection. This happens when the oil enters a blood vessel and triggers a pulmonary reaction. While not usually life-threatening, it can be extremely uncomfortable. At higher doses like 500 milligrams per week, the frequency of tren cough may increase, making administration more unpleasant. Increased sweating and night sweats. Trenbolone significantly raises body temperature, leading to excessive sweating, especially at night. Users often report waking up drenched in sweat, even in cool environments. This thermogenic effect contributes to fat loss but can also be highly uncomfortable and disrupt sleep. Insulin resistance. Trenbolone can reduce insulin sensitivity, increasing the risk of developing type 2 diabetes in susceptible individuals. At 500 mg per week, this effect is more pronounced, meaning users must monitor their carbohydrate intake carefully to avoid blood sugar spikes. Final considerations. Using 500 mg of Trenbolone per week is an extremely aggressive approach that should only be considered by experienced steroid users who understand the risks. While the muscle gains and fat loss can be dramatic, the side effects can be severe and, in some cases, irreversible. Anyone considering Trenbolone at this dose should prioritize regular health monitoring, including blood pressure checks, cholesterol panels, and liver function tests. Additionally, running testosterone alongside Trenbolone is crucial to mitigate low T symptoms. Ultimately, the decision to use such a high dose should not be taken lightly, as the potential consequences extend far beyond short-term gains.